As a senior, having been out of the workforce for quite some time, I don't necessarily have access to what resources are out there. I don't even necessarily know where to go look.
That's something that we've been hearing from seniors across the county and even across the country, that they really want to receive services at the point that it's convenient for them. And as a system, we really need to respond to what the community wants.
I can't imagine how wonderful that would be.
The WISE program can help address vulnerability in our community because it helps connect the dots for people. It helps be proactive. The program is designed to meet people where they are, help deliver services how the individual wants them.
A hallmark of WISE is care management. Someone to help an adult navigate the puzzling labyrinth of services available. And while sometimes care management exists on a time-limited basis, perhaps 30 days from an insurer after a hospital discharge, what WISE seeks to create is long-term, ongoing care management for those who need it.
Washtenaw County is pretty lucky that we have a number of services, a number of great medical institutions, and the challenge comes when you're trying to access them. If you're an individual who is trying to access these services for yourself or for your family, where do you start? And so what's difficult is finding one place that you can access everything.
WISE will create a centralized point of access for older adults and their caregivers, really taking away one of the biggest problems and barriers that exist, which is who to call, when to call, why to call, which number.
It's powered by best practices. It's focused on predictable models. It's truly intended to look at the person in the most holistic way.
So it's 2018, and we should no longer take stabs in the dark at how to serve people. In psychiatry, across medicine, people are looking to evidence-based practices. What's the evidence that something works? We in social services owe people the same amount of fidelity when we deliver services.
We believe that by using those evidence-based practices, we will be changing older adults' outcomes and changing health outcomes in the broader community. Well, essentially what WISE will do is provide a dyad of a nurse practitioner and a social worker to go into the home of an older adult in order to address all issues related to health and social needs.
Right now, interagency referrals and referrals coming from any social workers that are embedded in health systems happen via email or via the phone or even on paper. There's no way to track if the referral has been accepted, if the referral has been fulfilled, and what the outcome of that has been. WISE will deliver a closed-loop process for referrals and a shared case noting system.
WISE is not seeking to recreate what others already do well. What we are seeking to do is create more meaningful communication, closed-loop referrals, a system where the right hand knows what the left hand is doing so that we all can be engaged in caring for the same individuals in ways where we're not duplicating services. WISE works best when all the collaborators and stakeholders are working together in a meaningful partnership. WISE exists to transform the experience of aging.
We know that rather than just fixing one little thing at a time, Band-Aid by Band-Aid, hopefully we will be able to try to address a system-wide change.
We would be underestimating our community's fullest potential to not at least endeavor to do this, because this is what it takes. This is what aging adults deserve so that they can live their best lives.
To have just a single one person would be freeing, is probably the word that comes to mind for me.